RFK Jr., known far-right politician and conspiracy theorist, has now been operating as the Secretary of Health and Human Services, a position usually awarded to health professionals, for 6 months. And since taking on the position, a myriad of chaotic headlines have ensued, documenting budget cuts, high-profile resignations, and public health outbreaks. Public health is in shambles, all in the name of making America healthy again. How did we end up in this crisis, and what is going on in public health? Welcome to BS, a podcast where we take an in depth look at different scientific and social phenomena and innovations, whilst tying them back to broader societal perspectives and why you should care. We hope you enjoy the episode. I'm not gonna lie. The first time I actually heard anti-vax rhetoric in person, I was a little gagged. Like, I remember speaking to my friend in high school and her just saying how her mom didn't want her or her sibling vaccinated, so they just weren't, and they've just been raw dogging life ever since. And I was like, oh, okay. Hmm.
Right. No, I feel like it gets worse every single year. And what started as like something that I think a lot of people would have considered like fringe and not like a very popular like, you know what I'm saying? Like, we used to call these people nut jobs, and like now that could be anybody. That could be half the population for all we know. Like, it's gotten to such a degree, very geometric progression. Like, at one point you like kind of turn an eye away because you're like, oh, like science debunks all of this, people are reasonable, like they're not going to feed into this mass hysteria surrounding misinformation. You turn back and look exactly what happens. So it's been a lot. Even like, oh my god, like just everything that's been going on with the CDC has been
Oh,
need to watch. I mean, all departments of public health have been going through it, but I feel like the CDC just has an extra curse on them lately that is just so hard to watch. Even if you like go to the CDC website and read all the different statements, like it literally feels dystopic gold. Like, if you go into the About Us section, they have like random statements that don't even necessarily correlate with the functioning of the like department. Like, it'll be statements about autism, illegal immigration, elective abortions, gender ideology, DEI, and just word soup of all the hot button topics that this administration has purposefully been targeting. And it's been a lot.
yeah, it definitely just feels like I'm in a George Orwell novel sometimes where I'm just like, hey guys, what's going on? Like, it feels like life keeps going as I'm like watching like actual government websites become 4chan forums. Like, I literally remember seeing like a TikTok of a teacher being like, this is the first time I've had to tell my students that like .gov websites does not necessarily mean that the information is credible anymore. And I'm just like, wow,
Right?
are we really at that
That
point?
That is so insane to me. Like, this is a real quote from the website of the Department of Health and Human Services. Mission critical activities of HHS will continue during the Democrat led government shutdown. Please use this site as a resource as the Trump administration works to reopen the government for the American people. Like, I'm talking about bipartisan government departments that are supposed to serve all US citizens. And like, this sounds like a baddies quote. Like, why are y'all getting up like this when, mind you, people are just trying to see the vaccine schedule? Like, what? Like, it's so clearly biased that like you said, like, what do you mean you can no longer trust what's on a .gov site? I feel like I'm in the Matrix. To your point of George Orwell, love 1984, such a good book, but I shouldn't feel like I'm living in 1984. Like, that should never be what, like, how I'm feeling.
No, I definitely agree. And I just knew all of this chaos was coming the second that they said that they were going to let RFK Jr. be the Secretary of the Department of Health and Human Services. And that is how we're getting to this episode today, y'all. What is going on at the CDC and like what is going on in public health as a whole? And today we're going to have 3 questions to break down what has been happening in these last 6 months of RFK being the Secretary of Department of Human Health Services. One being what changes have even been occurring in the CDC. I'm sure y'all have seen a lot of headlines. Two, what is MAHA, the movement led by RFK, and what are its main objectives? And three, what are the real world ramifications of all of these changes that they're doing, or at least trying to do?
Yeah, so to get us started, we've already talked about how the CDC is undergoing a lot of changes that are eyebrow raising at best and just downright deplorable at worst. So, to give a little background, the CDC, or the US Centers for Disease Control and Prevention, is the main public health agency of the United States, and it's also a forefront global health institute. The CDC collaborates with all different countries, the World Health Organization, in order to kind of lead and mitigate public health crises, because obviously we live in a much more globalized societies now, so you can't just work on public health within your borders, but also outside of the borders. It's important to do some surveillance and, just see what's going on. Before US aid was dissolved by this administration, the CDC would also help in terms of like helping foreign governments with their public health outbreaks, and managing their healthcare system. So the new political administration, which is headed by our current president, Donald Trump, has spearheaded a lot of large-scale changes, kind of revamping all federal agencies to align with their policy goals, and the CDC is one of them. And the biggest notable decision that we're discussing today is how the president appointed Robert F. Kennedy Jr., or RFK Jr., infamously, as the U.S. Secretary of Health and Human Services. And this was a very, very, very controversial choice, because if you don't know RFK Jr., which honestly you should be happy that you lived under that rock for so long, he has always been a loud and proud skeptic of a lot of modern medicine, especially vaccines. And he finds himself often spreading misinformation and conspiracy theories in regards to public health. So a lot of healthcare providers and public health officials were very, very concerned about a man who has at multiple times acknowledged that he would deconstruct the current public health framework, in order to kind of align himself with once again, some of the misinformation that he truly believes in. Like, I do think this man believes in a lot of what he's saying. And his power cannot be understated, because in this role, he currently oversees 20 plus divisions and regional offices with over 82,000 employees, which, considering some of the layoffs that are going to be occurring, will soon be 62,000 full-time employees. And so the Secretary of HHS does have an immense amount of power, with oversight over administrating and regulating Medicare and Medicaid, funding medical and scientific research, collaborating with domestic and global health agencies, and just leading the response to different public health emergencies. So we're putting somebody who doesn't have any healthcare experience, clearly shows that they don't like to align themselves with best in field practices, and I don't know, it's just annoying as a person anyways, into a position where they're leading the majority of the US's public health response. And so that has obviously led to different cascading effects.
So, how did RFK Jr. even end up in this position? Well, it all started when he himself was running as the Republican nominee for the 2024 presidential race, but shortly dropped out in August of 2024 and quite literally immediately endorsed Trump and had the Maha slogan running by September of 2024. And what Maha is essentially like a populist term that was coined in that September that focused on the fact that the US is trailing behind other developing countries in terms of our health metrics, such as our life expectancy, the amount of people who have chronic illnesses. And it was kind of hidden under the bipartisan concern that the US health infrastructure is just completely just disastrous. And their whole thing was that they have preventative measures that they want to take on that are going to find out the root causes of like why the US is like that. But instead of looking at the people that they want to be like and focusing on healthcare accessibility and larger underlying things that might be leading to poor health, like poverty, they decided that they wanted to do some fresh thinking and just proposition other things that they feel like would be a better way to handle our health crisis. And a lot of them seem to be focused on personal responsibility. So they've had to do with nutrition, physical activity, and just like leading healthy lifestyles. And because that they felt was going to address their main concerns, which is like life expectancy, chronic illness, and also a big emphasis on childhood disease. Like they kept on bringing up the health of our children in every single like whitehouse.gov page that was talking about MAHA.
I think that the large focus with personal responsibility is always really interesting to me because a once again it ignores a lot of other factors that plays into like the health of people. But another thing I think is interesting about the way RFK and I guess a lot of the people who surround themselves he surrounded himself with is that they act like it's something new. This is not the first time that y'all have tried to make nutrition, physical activity, leading a healthy lifestyle, leading a granola lifestyle. It's your job to make sure that you're eating right, exercising, getting enough. Like, that's nothing new either. So I think it's interesting that they almost kind of want to make it seem revolutionary and that they're making America healthy again and revamping our public health system when these are things that public officials have already addressed and have already tried and already have specific strategies to try to work towards those goals. And another thing is that in a gentler way too, like once again people have tried the more aggressive kind of nasty approach to these things and we've never seen the increase in statistics because when you make people feel bad and don't improve the underlying accessibility factors that are the reason they can't be that healthy, like nothing gets done. So it's just like it's weird because we've tried this path before and we've seen that it doesn't yield results. So I don't know why they think redoing the same thing again is going to put us in a better position when that has been something that spans decades and people have tried before.
Yeah, and honestly, that's how I knew that this was just one of the many things that are showing that this whole Maha movement is all for show. For example, like I said, so much emphasis on childhood health. How come gun violence is not being addressed? How come infectious disease is not being addressed? Okay, how come substance abuse is not being addressed? Like, over 1 million deaths from COVID, gun violence still being the leading cause of death for children and teens in the United States, and the opioid crisis heavily impacting youth. And yet, that is not something that Maha cares to talk about at all because those would require systemic changes. And the things that they have implemented, again, it's just giving these are for the headlines, like like partnering with Coca Cola to bring back cane sugar instead of high fructose corn syrup in Coke. I constantly hear people talk about this and listen, like, I get it. I know that foreign Coke tastes better than American Coke despite it being an American brand.
Listen,
Listen, but
it's
I'm just
true
like,
though. It's true though. True though. It is true. I do have to yield to that point.
but I'm just, it's just kind of giving like Kim, people are dying. There's so many things going on, and like that's what you decide to address, or even like the Red 40 hysteria. Because it's banned in certain European countries, like that's what we need to be focused on, as if there's some kind of gold standard for health. There are things banned here that they be eating in Europe. Where did y'all get that from? Like, if anything, these changes that have been going on in Maha are actually cause for concern. Like there is genuinely something new every day with them to the point where I'm not even sure if this episode will be up to date when it drops. Like one, they have just been saying a myriad of anti-scientific statements which are harmful within itself when it's coming from people that we should be trusting and should be professionals, okay? Talking about how gender identity is being impacted by the chemicals in the water supply, how raw milk is better than pasteurized milk, and the anti-seed oil frenzy, SSRI use being tied to mass shootings, and then the Tylenol drama of it all. Like, it's just like all of these anti-scientific claims that people are probably thinking, like, it's coming from literally the person who's leading the Department of Health and Human Services. Like, maybe this should be something that I should take into account seriously. Whole time it's not.
Exactly. It's when the trusted health officials are not trusted, nor are they health officials because they don't have the background in that area. It leads to issues like this and just the spread of misinformation that probably makes every scientist literally cringe and just want to shrink up into a ball. With Tylenol being kind of the most recent one that I think has like really hit the headlines, with a lot of people being like, this is rightfully not true. Like, this is literally just crap. But another group of people who are actually starting to feel unsafe. And I know now that there's going to be a lot of pregnant women that are going to refrain from taking Tylenol, which, to be clear, if you want to take Tylenol during your pregnancy, it's already recommended that you consult with your PCP or your gynecologist to see what is best for you. Obviously, like, do what is individually best for you when it comes to your health. But once again, spreading hysteria about something that isn't well documented, isn't well linked, and also like have underlying factors that should be studied. Like, for example, a lot of the times when pregnant women are taking Tylenol, it is because they have some sort of illness or fever that they're trying to treat with the Tylenol. If somebody gets shot in the stomach and then dies on their way to the hospital, you're not going to blame the bandage that they put on the wound. You would blame the underlying condition that led to them dying. And I only say this to say, like, there's multiple things to examine in that cause. And even some of the studies that they linked on the website didn't even directly talk about autism. They were discussing other things. And so this level of spreading misinformation is truly unacceptable. On a side note, I also just feel bad for the Tylenol CEO, because why was he 70 days into his job when the White House issued that statement?
Honestly, like, when you apply to something and you're not all the way qualified, like, I feel like this is just the most like exacerbated version of that. Like, he might have been like, okay, like, I can do what I need to do to keep the company running. He didn't even know the bomb that was about to hit him.
Mind you, he came out of retirement for this. He had been the CEO or CFO of other companies. He went into retirement, and Tylenol called him and asked him to take over as CEO. And immediately after, this is what occurred. Like, I would literally be like, now you got to increase my stock options. Because what are you talking about right now?
Like, I bet you he wished he was just on that boat in Cabo in retirement right now.
I'm saying he should have been on the golf course, but instead he's dealing with this. Some of the changes, specifically the CDC has undergone, has been mass layoffs. The deepest cuts that this administration has been doing in terms of HHS has been the FDA, CDC, and NIH, respectively. There's also been terminations of thousands of contracts. So many different research contracts, private and public corporations. He has RFK Jr. specifically has hired and fired a CDC director over claims of her being untrustworthy, and there's just a lot of high turnover at that org right now. I think she was only in that role for barely a month, and before he fired her, or I think Donald Trump fired her at the urging of RFK. One of them did. But basically, like, before that, when she got sworn in by the Senate, he was saying that she was unimpeachable and that she was, a physician at the highest of standards, XYZ. And then literally in a month, it immediately turned to her being untrustworthy because she refused to kind of yield to some of his claims. They also dropped the universal COVID-19 vaccine recommendation from the immunization schedule that recently just came out. And before that, it's because he fired the 17-person advisory committee on immunization practices, or ACIP, and he replaced that panel with his own selections. So there's been a lot of changes, and we're also seeing that in terms of the advisory boards, panels, the agencies, that a lot of people are kind of being hand selected by this administration. And they're really just hiring a lot of yes men who are going to kind of put out the statements and make the amendments to our public health framework that they want to see, even if it's not aligning with best practices in the field.
Yeah, and honestly, a good way to see what this administration cares about is to follow where the money is going. Like them cutting so many jobs from public health offices, and then also an estimated $12 billion being cut from the NIH, with cuts still occurring. That is just showing you that the people who say that, we're on it, like we're about to, do something revolutionary for public health, the whole time they're doing what they think is trimming the fat for things that are essential for our nation's like public health infrastructure to continue to function. And I literally remember like being in class and our TA pulling up a list of all of the words in your research that might lead to you being defunded. And it was just so stupid. Like, we were in a neuroethics class, so we saw a barrier and we were like, okay, so we can't talk about the blood brain barrier. Like, we're y'all too focused on quote unquote DEI, that like actual science is being impacted by like the fake frenzy that y'all are trying to create. And then even like as we see, at least from when this episode is being made, government is still shut down. And most of this is because of disagreements about Medicaid cuts. And it's referring back to the fact that Maha is so obsessed with children. Like a third of people who are on Medicaid are children. And then also Medicaid and healthcare costs for the average American is one of the main like debate points. And that's just another thing that I'm not really understanding, is that accessibility to healthcare is going to be one of the main things that can get us to preventative measures and doesn't have people just running to the ER when things get bad. However, y'all are trying to make people's deductibles higher, y'all are trying to make people's monthlies higher. So what's really going on?
Yeah, I think in general, a lot of the changes seem counterproductive. Like you say that you care about XYZ and the health of the American people, but they just make it harder for Americans to get annual checkups, which will allow them to be able to address any concerns before it actually evolves into a more complex disease state. You make like look at the current job market, and it's just like look at accessibility to food, look at accessibility to just free time. Like proponents of late stage capital, like I'm just looking at all the things that they say they care about, but the actual systemic change that would be needed to see improvement in any of these areas, if there was progress being made by previous administrations, y'all have just decided to basically cut all of that back and just revert us to the 80s basically, and like we're not taking any of these things as seriously as I think they would like to propose that we are. And there are real ramifications to the changes that Gold and I are discussing. Like, I know it all seems like it's a lot and it's very overwhelming, but like we're already starting to see the consequences of these things roll in. Even at the CDC, there's been just this culture of fear that has kind of been established, especially after a shooting that killed one officer at the headquarters. And in a lot of ways, that is because we have kind of demonized public health workers and officials and almost painted them as not wanting the best for American people, that they are, spreading random viruses or illnesses, or that they're all in it for the payola and the money, even despite the fact that a lot of the times people go into these career fields because they want to help people.
Yeah, and like another thing that I want to highlight in terms of the mass shooting that happened at the CDC is that for people who don't know, the CDC is located essentially right next to Emory's like main school campus. Like it is quite literally walking distance, if not damn near on campus. And when the information was first coming out that there was a shooting happening, it was painted as like a school shooting. And like I can tell you multiple reasons in which why like that is not true. For one, like the area that any kind of violence was occurring was around the CDC and then the CVS right across from the CDC. Like there are no classes or classrooms, nor are there dormitories in that area, which kind of had me confused at first as why this was being paid in a school shooting. And on top of that, this was at a time before students had moved in on campus. Like the earliest set of students coming in were supposed to be for like literally pre-orientation, and that wasn't even going to be until the next day. So a school shooting with no students on campus and no like classes going on that didn't even happen on any dorm or course area. Like, I feel like it was definitely used as some kind of cover up for what was actually going on, because they didn't really want to show like how much this misinformation that's being spread is starting to impact people.
I was going to say, we're definitely also seeing people just kind of take matters into their own hands as they realize that the federal government is not really going to align on the state of the field. So we're seeing states, professional associations, and universities take a larger role in setting public health guidelines as the federal government just kind of refuses to align with those best practices. For example, there have already been 2 alliances created, states on the West Coast and Hawaii, and then also northeastern states that are releasing their own immunization schedules, and they are also making sure that state insurers continue to insure certain vaccines that might have been left off the federal schedule but are in those states' schedule. We're seeing a lot of, once again, universities kind of look through and read through papers on their own, and so we're seeing this like grassroots efforts, which is very nice, but it also kind of demonstrates the point where we're at, where people are having to do the work that also requires a lot of funding, which is why so much of it comes from the federal government, especially when health should be a top priority when we consider what a federal government does for its people. And so the fact that it's now being fragmented leads to differences in access depending on what state you're in and what universities you're close by to. Does your state have the funding to provide certain things? Like, breaking it up in such a manner in the long run will probably not be sustainable.
Yeah, and that's another thing. Not only are they like adding more work onto what other like organizations already have to do, because they're too busy running a propaganda machine instead of doing what the Department of Health and Human Services is supposed to actually do. There's just so much long-term like ramifications to this, and like the Trump presidency is trying to do. Like, one, there was a lot of calls for a more natural way of living in Nazi Germany that often looked like, one, demonizing smoking and drinking, and two, like an emphasis on diet and exercise, which is something that we kind of see with the Maha movement and that like hammering down on personal responsibility, and also like othering what the regime's undesirables are. The amount of misinformation that has been spread about minority groups' health is astounding, and the fact that it's not being talked about more is something that honestly is clearly getting me hot. Like,
No, literally.
RFK Jr. literally saying that Black people need to be on a different vaccine schedule. And this is the person who is heading the Department of Health and Human Services.
This
Like,
is the first of that. I didn't even know that because maybe it's because he's made so many statements. I literally didn't even know he said that.
you're like, exactly, like his absolute insanity is getting lost in all of the other media headlines, and that's not the only misinformation about Black people that he's been spreading. And the attack on SSRI use and trying to link that to mass shootings, to me, was incredibly calculated. I feel like people often struggle with mental health, and these SSRIs are obviously godsends to many people, but again, like with the idea of doing away with society's undesirables, and again, like people that would not be able to like serve in the military, I think the demonization of the very healthcare that helps them was a very calculated decision. And then we have the stupid autism Tylenol gate, and honestly the just constant like discussions surrounding autism as something that definitely needs to be eradicated and is like somehow the biggest concern for childhood public health. As like I said, again, we don't have mass shootings taking out these kids literally by the tens. Like, it's crazy.
Yeah, this administration has a weird obsession with autism that I can't fully understand. And listen, we live in a deeply ableist society, and whenever it comes to conversations of health, disabled people will always kind of be the first on the chopping block because y'all view them as monsters and y'all view that their conditions as something that itself should be eradicated, not necessarily that we should move to a more inclusive society that would improve their quality of life. But like the specific like hammering in on autism, like I'm not fully understanding where that's coming from. But I feel like of all the disorders that I feel like they've been talking about, they specifically keep talking about autism, which in itself is a spectrum that has different levels of severity. And I literally just think that it's so insane the way they keep hammering in on autism, and especially because autism is such a complex disease that has so many different factors that impact you getting it. So the fact that they keep almost trying to make it like sole reasoning and like target very specific things when that's not really going to do anything either. Like it's almost like concepts of a plan, like they're acting like they're trying to make progress towards something but completely disregarding what autism even is and like the reason why there's no one sole kind of way to go about diagnosing it or like whatever risk factors can cause it. Yeah, it's just insane.
Yeah, and honestly, the Trump presidency actually has been attacking autism since his first term. So I cannot say that I'm surprised. And they have been spreading like anti-vax rhetoric about it since, again, his very first term. And obviously, as like we get better with diagnostic measures, more people are being diagnosed with autism, and of course they're making that out to be like a bad thing. So like I'm not really surprised. Like I said, again, like I really do think like if you are not white and cannot serve in the military, you should be as good as gone as far as they're concerned. And honestly, another thing that I really wanted to bring up was everything going on with Roe and like just the attack on women's autonomy, because increasing birth rate was another big topic in Nazi Germany health metrics. And there was always this kind of like, if you're a healthy woman, we will like basically fund or sponsor you to have more children. And there's like this emphasis on women leading healthy lifestyles so they can be healthy mothers and not necessarily because they should be able to enjoy their health. And I feel like with one, our situation going on with Roe, and then also, Lord, the Tylenol hysteria about what pregnant women should and should not be doing in order to be considered a healthy mother, I see again like a lot of parallels with that. And even the ICE raids, because I feel like it just feeds all into the propaganda of they're trying to replace us. We need to increase our birth rate and we need to have less of the people who aren't the in group, again, white Christian nationalists coming into these countries and even existing.
And the foundation of why this rhetoric can spread so far and kind of indoctrinate really people is that they are preying on the fact that we live in a society that has a very fractured relationship with health, especially after the COVID pandemic, which we've talked about a myriad of times on previous episodes. But in general, there has just been an increased health anxiety after the COVID pandemic, often attributed to the way the US handled the pandemic. We handled it very poorly, especially like leading things up to the states, constantly switching statements from the CDC, vaccine deployment. There's multiple things that we could talk about. And that is why, what do you call it? That is why we're kind of seeing people start to hinge their bets on more fringe theories and ideas because they feel as if they've currently been neglected or underserved by the government.
Yeah, and I just feel like the rising populism and political polarization in our country like has led to this. I distinctly remember this one news article, like I think it was under a larger branch and it immediately being categorized as like a liberal news article because it recognized the existence of climate change. And I think at that moment a couple years ago, like that's when I really realized where we were at as a society and how hard it is going to be to actually spread the correct information without seeming as if there's some agenda behind it, and how caring for just the health of people and actually wanting to make strides towards bettering that was going to be considered a political opinion.
Yeah, bipartisan rhetoric has definitely made navigating this issue harder, especially in a country where we're so deeply divided along party lines. So even if it is scientifically backed research or evidence based approaches, if it's coming from a quote unquote liberal perspective or a quote unquote Republican perspective or however, people are more likely to disregard it. And that leads me into my next point of how a lot of Maha rhetoric has to rely on the spread of misinformation and disinformation, especially to those with low health literacy. And people are constantly overwhelmed by information in a digital age, so it makes it so much harder to differentiate between professional and non-professional sources, especially if, once again, our literacy crisis in the United States, like if you have low literacy skills, if you're not the best with critical thinking, and then you're also divided along bipartisan lines, like it all just like blends itself into a smoothie that makes you the perfect victim for this type of rhetoric that they are pushing. And multiple comprehensive studies have shown that amplified misinformation always leads to an increased level of general confusion by the population, more risk taking behavior, and just a general mistrust in healthcare professionals and the overall healthcare system or public health system. And that makes having effective strategies to combat illness exceptionally hard, especially during periods of infectious disease epidemics. There's even a thing called infodemics, which is when a large spread of misinformation is launching at the same time that an infectious disease epidemic is going on, which makes it harder to combat the epidemic and leads to a larger spread in that disease. And this has always been something that has happened. Misinformation isn't nothing new, nor is crockpot science or random health remedies. But the rate at which this spreads and the amount of people that it can get out to is very different now with social media. Because you have to think about the fact that they're pairing algorithm generated echo chambers with a lot of emotional stimuli, which is usually negative, at a very accelerated rate. And then when you add in a nice helping of confirmation bias, you just end up worsening the issue. And so by playing on people's emotions around their health, and then also playing on the fact that they also don't have a lot of information about what to do concerning their health, you put people in a position where they can accept nearly anything if the right spokesperson comes up to bat.
Yeah, and honestly, on the same train of the social media aspect of misinformation spread, like there is so much money in fear. And you kind of see it with the way certain wellness industry social media influencers go about it. Like, don't eat this, don't eat that, don't do this, don't do that. This thing is incredibly bad for you. Like they're preying on people's health anxieties and also preying on the fact that people don't have access to professionals. They make so much money off of being able to sell you that remedy and be the Dr. Sebi for you, and have the elixir or the workbook that will fix you, like your chronic illness or your grandma's chronic pain. And it's just like, as somebody who might be uninformed, as somebody who might be desperate, as somebody who doesn't have access to other options because the way our healthcare infrastructure is set up, like it's easy to again follow the guy who says, oh, all of these things are wrong and I know what's right and I can help you and give you that magic cure.
Yeah, it's really hard to sort between what is fake and not fake, especially when, once again, a lot of the sources that we previously would have considered reputable have shown that there might have some contradictions to other research in the field. So we did want to have a section about what you can do to protect yourself from misinformation. And listen, this is a constant battle. Both Gold and I are susceptible to propaganda. Anybody is susceptible to propaganda. And so just ensuring that you have a mindset to kind of stay attuned to that and make sure that you're always doing your due diligence in terms of the information that you consume. We compiled a list of recommendations from factcheck.org, which is a nonpartisan, nonprofit project originating out of UPenn. They do a lot of fact check work. I think they also like work in like our moderated debates, like the political debates. So factcheck.org itself is a very reputable source. So if you ever have questions about things, they take like questions on their website and they usually answer hot button issues that have been going around the media. And so one, consider your source. Always make sure that you look at what this person gets out of giving you this information. Like, are they getting money out of this? How long have they been doing research into this? What evidence are they using? All that stuff. Make sure that you evaluate the evidence that is presented in front of you, and also distinguish between, is it evidence or is it an opinion that is being postured as a fact or as evidence. And of course, consult the experts, and there's an emphasis on more than one expert. Even with reputable sources, you should still make sure that multiple outlets are reporting the same thing, because that's how we kind of build our consciousness of an issue. It can't just be one person saying it, and oftentimes that can also be a red flag. If only one media outlet is reporting on something and no other media outlet is covering it, that usually also points to the fact that there might be some underlying things going on as well.
Yeah, and honestly, like we said, we know it's difficult, especially with just this information overload of just the 2025 at this point, but it is really important because, like, as you've seen, real people are impacted by this. I think it was so easy to, again, fall into anti-vax rhetoric or hear somebody quoting a statistic or a research paper and not hearing the background of it and just kind of going with the ethos of like, oh, this was in a research paper or this had a percentage in it. But you have to really think like, why do they care so much? The same administration that is literally handcuffing naked children is saying that like children's health is at the forefront of their concerns. Like, there needs to be something that make sense. Like, there needs to be a bridge. And unfortunately, the way our current government is going and the cuts that they are putting in professional sources that were supposed to provide you with that, a lot of that is going to land on you to make sure you understand, again, like Ilyana said, why these sources are saying the things that they are. And also, like, what is the main goal of them doing the things that they're doing, sharing the information that they're sharing, and like needing you to feel the same way as them.
Yeah, but with all of that said, we always have our required reading in the description box. We don't think we're exempt from this in any ways. In fact, we always encourage you guys to fact check us, look at the research that we're doing and what sources we've been utilizing. And honestly, if you guys have any cool articles or pieces that come up, definitely email them to us. We would love to take a look at it. And we always want to foster an inclusive environment that allows debate. And so with that, we're going to get into everybody's favorite section, which is bits of BS. And to refresh our audience's memory, that is when we in Gold go over particularly funny, trying, annoying, or just interesting moments that occurred to us during our undergraduate careers. So I'll go first. My bit of BS for today is I used to always be late to one of my classes. And I know that that doesn't sound, mind you, this was a 8:25 class. I hated 8 a.m.s. I'm terrible with 8 a.m.s. And then I also lived off campus. I didn't live too far off campus, and my parking deck was right next to my class. So my excuses honestly were little. Like, I could have definitely gotten to class within 10 minutes, but I just hated the 8:25. I would never get up on time. And the definition of insanity is doing the same thing over and over. And I would always set my alarms for the same time and then always be late. And I would always be like, I should set my alarms earlier. Never did. But basically, I always came late to this class. The thing is, I never came too late to the class. I was always like maybe like a couple minutes late, 5 minutes late, never more than like 5 minutes late. But my professor was so over me, like, and they were so strict on attendance gold. So when I tell you that, like, I almost didn't get an A because of the amount of like points that they were docking, because we basically had like a participation professionalism grade or something like that, and they were basically docking my professionalism grade because I kept coming in late. And I could see that like my professor was losing respect for me with each time, because I think I started off as one of his favorite students, and then it started to just be like, she always come late to this class, I'm over it. So yeah, I had to do extra credit CAD assignments in order to get an A, even though I put a lot of effort into that class. So it was my own fault, but at the same time, I'd be like, I'm 5 minutes late. You're not even past announcements, and I was here for all of the work. But anyways, it's like my fault, but also at the same time, in my head, I'm like, it wasn't that deep, but it definitely was my fault.
Yeah, like honestly, freshman year, I was so on top of like my AAMs, 8:30s, but I did have an 8:30 senior year. And sometimes I would just be so late that I'm like, should I even go? Should I
Like,
even walk up in this person's
like
class?
freshman year, the 8 a.m.s were fine. I don't know what happened. Like literally freshman year, I was cool, and then immediately after, I didn't have the capacity for it anymore.
Ooh, Alexa play I'm Tired by Labyrinth. But yeah, like honestly, quite relatable. Like there are so many times where I was like, I actually low key need to lock in because attendance does matter for this class. And for my bit of BS, this one was just so funny to me because I just thought it was such a random thing for somebody to do and say. And essentially, we had a professor, just again, STEM course, discussing how Black people contributed to this one like specific innovation or finding because it was like February and Black History Month, and she just wanted to include that. Nice. However, this was a recorded lecture, and after the class ended, I think she stopped, like she forgot to stop hitting like she forgot to like hit stop on the recording. So like you could hear her discussing with another professor like, "Oh yeah, like I added Black people to the slides and they loved it," and how she basically like deserves a raise.
I'm so they gonna love this. Like
Like yeah, and then she just basically was talking about how she feels like she deserves a raise because like um that was just like a good idea on her. I was like, okay girl, you showed one or two Black people, now you're doing too much. Like, and she literally posted that video for us to review, not even knowing that like that part was still in the recording. And I was like, right, okay,
she said,
don't
I'm
worry,
trying
you're
to get
about to
my
be hearing from me.
I'm trying to get my pape up. Honestly, who knows if she did it on purpose? Maybe she did, and like that was subliminal messaging. And there's
Exact clock that because I'm just like, what was that about? Like, dang, she said I threw you a bone, I deserve a couple of dollars for that. Like,
I'm saying, she said, "Happy Black History Month. I take checks." Like, thanks.
she turned that iPad around immediately, like 15%, 20, 25.
Go ahead and leave me a tip. Thank you. Thank you. But yeah. All right, guys, we have gotten into everything that is going on with just the crisis of public health in this country. We know times are dire. We do. We do know that times are rough, but we have to encourage radical optimism. We have to encourage you guys always making sure to do your research. So please remain educated, remain curious, and remain critical because that is going to be what makes sure to guide you in the future. So with all of that, we'll see y'all in the next one. Bye.
Bye.